Thursdays are Dr. Ruth days. Dr. Ruth Berggren from the Long School of Medicine at UT Health San Antonio, an infectious disease doctor, joins us live now to answer our questions and your questions as we go through this COVID pandemic. Dr. Berggren, thank you for joining us. Right off the top, we've been getting a lot of questions from viewers about school. And I know that you've been involved with an organization that's trying to make it easy for parents to understand whether it's safe or not for in-person classes, in your opinion.
Right. So the city has organized the COVID-19 Community Response Coalition that has several working groups, and one of them is focused specifically on school. It's a really robust committee, and they have now decided to create a new indicator bar for the COVID-19 website. When we look at the city's website to understand progress and warning indicators, there's going to be a new indicator bar that has to do with how conditions are relative to the safety of going back to school. It will be color-coded. There'll be a red, yellow, green schematic, and a variety of parameters will factor into whether it's a red, yellow, or green situation, things like percent positive tests and the doubling time of disease rates in the city.
Of course, parents looking for any help to try to make that really, really tough decision. I want to ask you about testing. We heard from the county judge earlier in the show that sometimes results are taking 7 to 10 days to get back. So I've heard some people argue, well, why get tested at all then? What's your response to that?
So the goal is really that you're going to get a call back within 72 hours. We're aspirationally trying to get it under 48 hours. We're working towards it. Some of the depends on your test site really, and how busy things have been, the availability of reagents. And so I wouldn't want the people of San Antonio to think it's always a 7-day wait. It's oftentimes much less than that. And it can really be very helpful in sorting out what else is going on with someone's health. So it's discouraging, yes, that we have some people having such a long wait to get their results, but that doesn't mean it's not helpful to get it. And ultimately, there are implications, right? There's implications not just for you, the person who's waiting for their test result, but the people that are around you, your household, and then the people that you've been in contact with. And that affects contact tracing, and we also need to understand what's going on. So don't give up on it. I wish it was faster, but it's not an unhelpful thing to get the test, even if there's a long wait.
How concerned are you about us not being able to flatten the curve, so to speak, before Labor Day?
Well, our models are suggesting that we are going to be coming down off of this high plateau where we're just below our bed capacity. So we are at a very stressed level for the health system overall, but we're plateauing. And it does look like we're going to be starting to come down off of that plateau by the end of the month and continue to step down slowly through the month of August. I would really like to see us get that curve as flat as possible before Labor Day, because then we can feel safer about having children go back to school in person. And that is so important for so many reasons, but it needs to be safe.
Are there additional restrictions that you'd like to see in place?
Well, I would first of all like to see people using their masks correctly, consistently. I would like to see people demonstrating an understanding of the social distancing. I know that I've spoken to extended family members, not me personally, but extended family members that have been in airports recently, and they see masking, but they don't see people paying attention to the social distancing, the 6-foot distancing. And I really do think we should be very minimal with respect to how full businesses are. I don't think it would be out of the question to really roll back the restrictions to a more strict level than we are right now to help facilitate this very important flattening of the curve.
I think right now people are looking for any sign of improvement, any indication as to where we're headed. It's encouraging to hear you say that towards the end of the month, hopefully we'll be on that decline, and then into August before Labor Day. We've talked about hospitalizations being on the decline this week. It's been a small decline, but is that enough of a sign for you to say that we are improving here locally?
So we never look at a single day's worth of data, right? But the curves that we've been looking at that show the average daily census in the hospital, they are showing us for more than a week now that we're plateaued to slightly down. And that is a very important indicator. We know that hospitalization rates cannot be affected by how many tests are being done in the community, so you can't really get misled by them. So it is an important indicator. But here's a big caveat. We saw a big surge and a prolonged plateau that was contributed to by what happened over 4th of July. We're coming up on Labor Day. If we have the same kinds of family get-togethers and barbecues on Labor Day as we did during the 4th of July, 2 weeks later, we're going to see another rise. And we could continue like this in cyclical fashion, kind of like a roller coaster, depending on what we do. So we don't have to sit around and just take it and say these things are happening to us and there's nothing we can do about it. It is all directly related to our social behavior. So if we don't want to see it go spiking back up after Labor Day, we have to be very serious about what we're going to do with ourselves over Labor Day and in between times.
We can all have an impact. Dr. Ruth Berggren, thank you for your time, and we'll see you tonight on the Night Beat at 10.
Thank you.
We'll be right back.